Most people over 60 eat fruit every single morning with the quiet belief that it must be good for them. Fruit is natural. Fruit is fresh. The label on the bag says heart healthy. And yet your fasting blood sugar keeps climbing month after month, and you cannot understand why. Here is what almost no one will tell you. Not every fruit is your friend after 60. Some fruits, when eaten the wrong way at the wrong hour of the day, will push your A1C up faster than a slice of white bread. And on the other side, there is a single ordinary fruit costing less than $1 a serving that a meta-analysis of 22 clinical trials published in 2022 found could lower fasting blood glucose by nearly 18 milligrams per deciliter. The truth is this: after 60, your liver and your muscle cells do not respond to insulin the way they did at 30. The same apple, the same handful of grapes, the same little bowl of fruit at breakfast. Your body processes it in a completely different way than your children or grandchildren do. Pick the wrong fruit, eat it at the wrong moment, and your fasting numbers keep climbing no matter how faithfully you take your medication. And every month, those numbers stay high, the risk of kidney trouble, nerve pain, and vision problems quietly grows. Today, I am going to give you the 3 best fruits for anyone over 60 who is living with prediabetes or type 2 diabetes. I am going to tell you exactly why each one works inside your body. And I am going to share one timing mistake that nearly every person your age makes with fruit in the morning. A mistake that can quietly cancel out everything you are trying to do. I'm Dr. Ryan Michel. For more than 20 years, I have sat across from patients in my endocrinology clinic and watched their A1C numbers go up and down based on the smallest changes in what they ate, when they ate it, and how they combined it. And what I learned was this: the patients who failed with diet were almost never failing because they ate too much fruit. They were failing because they were eating the wrong fruit in the wrong order at the wrong time of day. By the end of this video, you will know exactly which 3 fruits belong in your kitchen this week, how to eat them so they actually lower your blood sugar instead of raising it, and that one morning mistake to avoid starting tomorrow. Before we go any further, do me a small favor. Leave your age in the comments below and tell me one thing. What is the fruit you reach for most often in the morning? I read every single comment because your answers tell me exactly where you are on this journey, and they shape what I cover next. Now, let's start at number 3. A fruit so common you almost certainly have one sitting on your counter right now. Yet most people are eating it in a way that strips away its single most important benefit. Before I give you that fruit, I need you to understand something most doctors never take the time to explain. Fruit is not one single thing. It is not like salt, where less is always better and more is always worse. Fruit behaves inside your body in completely different ways depending on what is wrapped around the sugar. Here's what actually happens when you bite into a piece of fruit. Most of the sugar in fruit is fructose, and fructose does not go straight into your bloodstream the way the sugar in bread or rice does. It takes a detour. It travels first to your liver. Your liver decides what to do with it. And in small amounts, with the fiber of the whole fruit still wrapped around it, your liver handles it beautifully. Blood sugar stays calm. No spike, no crash. But your liver at 65 or 70 is not the liver you had at 30. Think of it like a water treatment plant that has been running quietly for 6 decades. It still works. It still does its job, but the capacity is lower. The valves are slower, and when fructose arrives too quickly without fiber acting as a brake, that old plant becomes overwhelmed. It turns the extra fructose into liver fat, and worse, the liver itself starts ignoring insulin. We call that hepatic insulin resistance. Once your liver stops listening to insulin, your fasting blood sugar climbs in the morning, even after 12 hours of not eating a single bite. This is why some fruits help you and some fruits hurt you. It is not just about how much sugar is on the label. It is about 3 things working together. First, the soluble fiber inside the fruit. Second, the polyphenols and pigments it carries. And third, the speed at which that sugar gets to your liver. Once you see fruit through these 3 filters, the next 3 I'm going to give you stop looking like a random list. They start looking like exactly what your aging liver needs. So let's begin with number 3 on this list, the apple. And I know the moment I say apple, half of you are already thinking my doctor told me apples are too sugary, or I cut apples out years ago. Please stay with me because what I'm about to share is the reason the old saying about an apple a day refuses to die. The science actually backs it up, but only if you eat it correctly. The key compound inside an apple is called pectin. Pectin is a soluble fiber, and it lives mostly in the skin and in the layer of flesh just beneath it. The moment pectin meets the acid in your stomach, something remarkable happens. It turns into a soft gel. That gel forms a thin coating along the inside of your gut, almost like a fine mesh on the inside of a funnel. The sugar from your meal still passes through, but it passes through slowly, drop by drop, instead of pouring all at once into your bloodstream. This is not a small effect. A study published in the journal Diabetologia found that pectin can reduce the amount of insulin your body needs after a meal by roughly 35%. Let me say that again because I want it to land. 35% less work for your already tired pancreas. From a fiber that is sitting inside the skin of a fruit that costs less than $1, there is more. Researchers in Japan have shown that the order in which you eat your food changes everything. When their participants ate an apple before their rice, the peak of blood sugar after the meal was lower and arrived later than when they ate the rice alone. The whole curve flattened. But here is where most of my patients quietly go wrong. They peel the apple because they were taught somewhere along the way that the skin is hard to digest. They drink apple juice thinking it is the next best thing, or they spoon out store-bought applesauce. The moment that skin comes off, or the fruit goes through a press, or the flesh is cooked down into sauce, the pectin is gone or broken. The medicine is gone. What is left is sugar water. I want you to eat one medium apple. Skin on, washed carefully, sliced, eaten after a small amount of protein never before, not as a snack on its own at 3 o'clock in the afternoon, after your exit breakfast, or after a piece of fish at lunch. Let me tell you about Karen. She was 67 when she first came to my office. Her fasting blood sugar was hovering between 140 and 150 every single morning. And she could not understand why because she had been eating what she called a low-carb diet for 6 months. She had cut out bread, rice, pasta, all of it. When I asked her to write down everything she ate for 1 week, one line jumped out at me. Every morning she was drinking a small glass of pure, unsweetened apple juice, no added sugar. She thought she was being careful. We replaced that glass with half an apple, skin on, eaten right after her eggs. 6 weeks later, her fasting blood sugar had come down to 118. Nothing else in her day had changed. One simple swap from juice back into fruit. Now we move to number 2, and this one surprises almost every patient I share it with. Have you ever wondered if there is a fruit out there that you can eat, even a generous portion of it, and your blood sugar barely moves a single point? There is, and it is sitting in the produce section of every grocery store in America, but most people your age have never thought of it as a fruit at all. Number 2 is the avocado. I know most of you think of avocado as something you put in guacamole at a Mexican restaurant or maybe spread on toast at a cafe, but botanically an avocado is fruit, and the way it behaves inside your body is unlike almost anything else in the fruit aisle. The glycemic index of an avocado is around 15. For comparison, a ripe banana sits at 62. An avocado is essentially flat. It does not spike. It does not crash. It barely registers on your blood sugar at all. Here is why. Half an avocado gives you about 7 grams of fiber, mostly soluble. It is rich in oleic acid, the same heart-friendly fat that makes olive oil so valuable, and it carries almost no fast-absorbed carbohydrate. When you eat it alongside a meal, the fat and fiber slow down how quickly your stomach empties. Glucose from the rest of your plate trickles into the blood instead of flooding it. There is something even more interesting called the second meal effect. Eating avocado in the morning has been shown to help keep your blood sugar steadier at lunch as well. It is as if the avocado is still working for you 4 or 5 hours later. A study published in Nutrients in 2019 looking at over 7,000 adults found that people who ate avocado regularly had measurably lower insulin resistance than people who did not, even after the researchers adjusted for age and weight. Another trial in the Journal of Nutrition showed that adding half an avocado to lunch reduced the urge to snack between meals by about 26%. For someone over 60 trying to keep A1C in check, cutting out the afternoon nibbling is one of the most powerful things you can do. Now let me pause for a second. I am curious about something in the comments. I want a simple answer. Yes or no. Have you ever eaten avocado as part of your breakfast? Just type yes or no. Your answers tell me whether to make my next video a full breakfast plan or whether I should focus somewhere else entirely. Here is how I want you to use it. Roughly 1/3 to 1/2 of a medium avocado per day is plenty. Slice it next to your scrambled eggs in the morning. Mash it onto a slice of whole grain bread instead of butter. Cube it into a lunchtime salad with grilled chicken and olive oil. What I do not want you to do is throw it into a blender with banana and milk and call it a smoothie. The moment you blend it with sweet fruit, you turn a good choice into something that behaves like liquid sugar. And now we arrive at number 1. If I were forced to keep only one single fruit on the shelf for every patient over 60 living with type 2 diabetes, this would be the one I would choose without hesitation. And the reason has nothing to do with taste or tradition. The reason lives inside a tiny enzyme deep within your cells. Number one is the blueberry. The compound that does the work in a blueberry is called anthocyanin. Anthocyanin is the deep bluish-purple pigment that gives the berry its color. It is not a vitamin. It is not a mineral. It is a plant pigment with a job. And the job it does inside your body is genuinely remarkable. When anthocyanin enters your bloodstream, it switches on something called AMK. The full name is adenosine monophosphate activated protein kinase. But you do not need to remember that. Just think of it as the master switch inside each of your cells. When the switch is off, your cells stay closed. Glucose floats around in your blood, knocking on the door, and the cell does not answer. That is what we call insulin resistance. When that switch flips on, the door opens. Glucose moves out of your blood and into the cell where it gets burned for energy. Your blood sugar drops. Insulin starts working again. And here is the part that matters most. The effect lasts for hours after you finish eating. This is not theory. A meta-analysis pulling together 22 randomized controlled trials published in Nutrition, Metabolism, and Cardiovascular Diseases in 2022 found that blueberry and cranberry intake reduced fasting blood glucose by nearly 18 milligrams per deciliter and lowered A1C by about 0.32% in people with type 2 diabetes. Let me put that in real terms. If your A1C today is 7.4, that 0.32% is exactly the distance between you and the 7 that your doctor keeps asking you to hit from fruit. Not from a new medication, not from a procedure, from half a cup of berries in your yogurt. There is more. A clinical trial out of the University of East Anglia published in 2021 gave 1 cup of blueberries per day to adults with metabolic syndrome whose average age was 63. Not college students, not athletes, people your age with the same metabolic struggles you may be facing right now. After the trial, their fasting glucose was lower, their fasting insulin was lower, and their cholesterol numbers improved. Let me tell you about Eleanor. She came to me at 71. She had been on metformin for 4 years, and her A1C had stalled at 8.1. Her previous doctor had started talking about insulin injections, and she was frightened of needles. She told me, "I am not ready for that yet." I did not ask her to cut out carbs. I did not ask her to fast for 16 hours a day. I asked her to do 3 small things. Add half a cup of frozen blueberries to plain Greek yogurt every morning. Eat them after 2 boiled eggs, not before. And stop drinking the small glass of orange juice she had been having at breakfast for 40 years. 4 months later, her A1C was 6.7. Her primary care doctor actually lowered her metformin dose. No miracle, just biochemistry doing what biochemistry does when you finally feed it the right thing. Here's how I want you to use blueberries. Half a cup to 1 full cup per day. Frozen works as well as fresh and sometimes better because they are frozen at peak ripeness, which protects the anthocyanin inside. Eat them after a protein, eggs, Greek yogurt, cottage cheese. Never on an empty stomach in the morning. And one important word of caution, I am not telling you that blueberries replace your metformin. I am not telling you to stop a single pill your doctor has prescribed. What I am saying is that for my patients who keep taking their medication faithfully, blueberries work alongside it, not instead of it. Alongside now, before I let you go to the kitchen and start, I have to warn you about something because I have watched too many patients do everything I just told you and then quietly undo all of it with one small mistake first thing in the morning. Have you ever wondered why you can eat what feels like the healthiest breakfast in the world, a bowl of fresh fruit, maybe some berries, maybe a sliced apple, and your fasting blood sugar the next day still goes up? The answer is timing. And the mistake is eating fruit on an empty stomach, especially in the early morning hours. Here's what almost no one explains to you. Between roughly 4 in the morning and 8 o'clock in the morning, your body is already busy. Cortisol is rising. Growth hormone is rising. These 2 hormones tell your liver to release stored glucose into your blood to help you wake up and get moving. We call this the dawn phenomenon. Your blood sugar is already climbing before your feet even touch the floor. Now imagine landing a bowl of fruit on top of that. The fructose hits a liver that is already in release mode. The peak you create is much higher than it would have been if you had eaten that same bowl of fruit in the middle of the afternoon. The fix is shockingly simple. It is about order protein and fat first, then a small portion of vegetable or fiber, then your fruit at the end, almost like a small sweet dessert to your breakfast. Researchers at Weill Cornell published a study in 2015 showing that simply rearranging the order of foods at a meal, eating protein and vegetables first and carbohydrates last, reduced the post-meal glucose spike by about 37% in people with type 2 diabetes. Same food, same calories, different order, a completely different curve. Now, I want to be careful here. I am not telling you that eating fruit in the morning is wrong. I am telling you that fruit should never be the very first thing your empty stomach sees. 2 boiled eggs, a small bowl of Greek yogurt, even a slice of cheese. Eat that first, then your apple, your avocado, or your blueberries. That single change, costing you nothing, protects you more than any specific fruit choice ever will. So you now know the 3 fruits. You know exactly how each one works inside your aging body. And you know the one timing trap to avoid. Let's pull all of this together into something simple you can start tomorrow morning. Here's what I want you to walk away with. Fruit is not the enemy of someone living with diabetes after 60. Choosing the wrong fruit and eating it at the wrong moment is the enemy. The 3 fruits that truly belong on your plate are the apple because of the pectin sitting in its skin, the avocado because of the fat and fiber that flatten your blood sugar curve, and the blueberry because of the anthocyanin that flips on the master switch inside your cells. And above all of that, one rule rises higher than every fruit on the list. Never let fruit be the first thing your empty stomach sees. Always protein first. So here is your morning starting tomorrow. After you wake up, 2 boiled eggs or a small bowl of plain Greek yogurt, and then half a cup of frozen blueberries on top. At lunch, half an avocado sliced into a salad or mashed onto a piece of whole grain toast in place of butter. After your lunch or your light dinner, 1 small apple, skin on, sliced. That is the whole plan. Measure your fasting blood sugar every morning for the next 2 weeks and write it down in a small notebook. At your next appointment, ask your doctor one simple, gentle question. Could we schedule an A1C check-in about 3 months so we can see how my new eating pattern is working? Now I want to hear from you. Of these 3 fruits, the apple, the avocado, the blueberry, which one are you going to add to your breakfast first this week? And if you are comfortable, share your most recent A1C number in the comments. I read every single answer because that number tells me exactly where you are starting from, and it helps me make the next video genuinely useful for you. And if you know someone, a brother, a sister, a friend at church, a spouse whose fasting numbers in the morning are quietly climbing, please send this video to them. A small change in the refrigerator can rewrite the next 6 months of someone's health. I'm Dr. Ryan Michel. After more than 20 years of watching my patients take back control of their blood sugar through small patient changes, I want you to feel that same control, calm, in charge, knowing exactly what you are doing for your own body. Everything I shared today is for education, and it is not a replacement for the advice of the doctor who knows your full history. Please do not stop your metformin, your insulin, or any other medication because of something you heard in a video. Bring this conversation with you to your next appointment and let your doctor walk through it with you. Wishing you gentler mornings, a kinder liver, and a calmer pancreas. If this video helped you today, tap subscribe so I can keep walking this road with you. I will see you in the next one.